Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I meet a lot of different people as the publisher of Boomer Times and the radio talk show host, but there's something about Leslie Carmen that just wins you over when you meet her, because she's just has kindness in her eyes and her ways. And for her to get into this business is so appropriate because, Leslie, when people are in pain, they just put everything else aside. It's not that they're mean to their family, but I mean, they're mean to themselves. I mean, they just change. They can't think straight. And so when they come to you, and hopefully they are going to come to you, a lot of them, it's going to require someone of your heart and to talk to them first to know just how serious it is. What can you do? What can't you do?
Right, exactly. Well, good morning, Anita. Thank you for having me on the show. Good morning, everybody. Yes, we see a lot of patients that come to our clinic in excruciating pain, and the saddest thing is that they've usually come to us as their last hope because they've tried everything. They've had MRI, X-rays, and so forth, and no one can really understand what's wrong with them. I mean, obviously, many patients come in with back pain, knee pain, and so forth. But then there are a lot that just say, nobody can help me. I don't know what's wrong with me. I don't know why I have such pain. Or their pain is just so excruciating. You can see it in their eyes. And so we sit down and we talk, and usually it's just an accumulation of a lifetime of pain, of a lot of different things. So neck pain, back pain, and they feel that, there's so much wrong with me, when at the end really a lot is coming from the spine. And, before I talk about anything medically, if you just allow me to quickly give this disclaimer. So some of the statements that I'm about to make have not been evaluated by the FDA and should not be construed as medical advice. So what I'm about to tell you are experiences of our patients as they have reported to me. So I just want to really say that before I start talking.
That's fair.
Thank you. So I was trained by Dr. Wolf, Enrique Wolf, a neurologist in Miami. He's a consultant, and he explained to me that nearly all of the pain comes from the spine. So when we have patients that come in and they say, my back hurts, and then I have pain on the side of my legs and my feet and my toes, you can't help me. That's so much pain. It's everywhere. Well, many times we just give laser therapy to the lower back, the entire lower spine, and then most of the pain disappears because the healing is occurring in the spine, on the nerves. So the myelin sheath of the nerves actually start healing, and that's the pain that is usually triggered, the referred pain down the legs into the feet and so forth. So, with some easy therapy, we can actually, really, help with the healing.
And people are probably wondering, well, are you giving me shots? What are you giving me? And I think it's important for you to explain about this wonderful gadget that's called a laser, cold laser therapy.
Absolutely. I'll be happy to do that. Yes. So the laser stimulates your cells on a very natural way by many things actually happen when you give laser therapy. So I just want to make it simplify it. So we have our cells, and our cells need a form of energy, which is called ATP. So it's like basically charging a battery. So if you look at your body and it's a full battery, it works at its best capacity. But outside influences such as stress, food, nutrition, the pesticides in our food, unfortunately. I'm not here to make a political statement at all. It's just about, our environment. It's so toxic, and we can't change that. But that has an influence on our body, on our cells. So every time we have stress in our life, this battery gets depleted a little bit. Stress meaning, also food or personal stress. So that battery goes down, and now we're not able to take care of our body the way we're supposed to.
So we need a charge.
We need a charge, exactly. And so this laser, I'm putting this in very layman's term, right? Because that's what we want to do. So this laser actually recharges your battery. And gives you this energy. So your cells start working better. They start reducing inflammation. The cells start increasing. So there's even a form of stem cells. It produces more cells in your body. So your body is just starting to work better. And while it's doing that, it's able to, again, reduce inflammation, which in turn reduces pain, increases cell permeability, which gives elasticity back into the cell walls. So if you think of us, all we are cells, right? 100 trillion cells. That's all we are: muscle cells, bone cells, and so forth. So now you're giving elasticity back into these muscle cells. Well, when you have spasms in your back that, are caused due to the pain, the inflammation, and so forth, you're bringing in back collagen into those muscle cells. Well, they become elastic. And so now that muscle isn't spasming as much. And that is a main cause. The piriformis muscle, that's a muscle that goes in the buttocks area there, presses on that sciatica nerve. So when we give laser therapy, that muscle becomes soft and, more flexible. And we can have patients get up and say, wow, I already feel better after just one treatment. Now, that's not always the case. You need longer treatments for long-lasting results, or for at least, a long-lasting reduction of your pain. So, those are things that the laser will do for you.
Well, I know when I have attended your seminars that you also talk about people with migraines.
Absolutely.
And so what does that do?
Well, when you have migraines, you have a depletion of that energy in the cells. So, when I've gone to work and sometimes I come in and I feel I'm starting to get a headache, I will right away put the laser on my neck in the back here and start treating the areas of pain, and instantly actually within about 10 minutes, but it starts instantly. The ATP level, that energy level, shoots up in your cells and your headache goes away because it's oxygen that's being delivered to those brain cells. And,
Well, it's really a very exciting, responsibility. As a matter of fact, it is a big responsibility because someone comes in pain and they're expecting you to do something about it.
I know. Sometimes it's very difficult because they'll come in here saying, okay, I've suffered 25 years and I've had they don't tell them that. No. I know they've suffered 25 years.
Right.
And they come in after, let's say, 5 treatments, right, and they'll be like, I don't feel any better yet. And I try to keep a smile on my face.
Right.
And I do. I mean,
time.
Yes, I really feel very compassionate. And I understand, but sometimes it's frustrating because in this day and age, we want instant gratification. I want a pill to take this away. Give me a shot to take this away. And when you do something naturally, that's just going to take a while. And when you break an arm, I always give this example. I say, when you break an arm, right, it's going to take 6 weeks for those cells to regrow, attach, form, and you're giving me, like 2 little treatments and you already want gratification. So I just say natural healing will take a longer time, but at least it's something that you're doing that's not invasive. It's not hurting your body. And this is the wonderful thing. We have this other laser that we're using, and it's called COMRA therapy. And it's a fantastic thing. It's 4 separate healing modalities, and it is laser, but it's also light, magnetism, and ultrasound. And this modality combined together has been found that as a whole is greater than the individual parts. And when we started with this device, because first I started with other lasers, but because we're a laser clinic, we're always trying to find more modalities out there to help people. So with this laser, we are now able to actually get patients better even faster. And that is so exciting because we're seeing patients come in, that have had, talk about excruciating pain, post-herpetic neuralgia. I don't know if you know what that is. That comes from the shingles. And I've had one patient come in and he had to literally dig his nails into the side of his skin, really, really practically crying in pain. A grown man, he was a boxer, fought on Madison Square Garden, I think he said, and came in with such pain. And the thing is, he was actually in tears also for his wife because he said, listen, I have the need to help my wife. She depends on me, so I cannot break down. And I said, yeah, absolutely. We'll do everything we can. So he sat down. I just pulled up the shirt, used this special modality, this laser. And
excuse me, do you
yes.
put it exactly right on?
You put it right
shingles.
on the skin. Yes. Well, here's the thing with the shingles. You do have to treat the patient after he's had the crusting, of the bubbles,
yes,
right?
Yes.
So you want to wait until that's all healed up. First of all, it's very contagious. And second of all, you want to just wait till that's all healed. But after the shingles, some patients experience nerve damage, which is on the skin. And that's what's really causing the pain. And you usually don't see any blisters or anything after that. And so we treat with the laser right on the skin, and we treat him for 20 minutes. And he put his shirt down and he stopped for a second. I could see in his eyes that he was baffled. And he got down and he touched his skin. He just came to me and he hugged me and he started crying. And obviously I started crying. And he said, Leslie, this is amazing. I have practically no more pain. So with this patient, after 2 visits, he was pain-free of this post-herpetic neuralgia, which is just absolutely excruciating. So sometimes we can help somebody within 2 treatments, but normally it does take a longer time.
All right, well, let's just talk about all the different causes of pain. So we talked about that, and we talked about migraines. And what other kinds of you? Let's say that you've, like the carpal tunnel. I was thinking about that because my daughter-in-law's mother is suffering. She's going to have an operation on both of them, and she lives in Miami, and she's Italian. She does not speak English, and I wanted very much for her to come see you. And then I thought, well, maybe we should just buy this for her.
Absolutely.
Because I know that you're selling them, but I'm not as close to them as I feel like I could.
Well, you're always welcome to give them my phone number, or I can call them and we can have a
speak Italian?
Un po, solo un po.
Well, her mother does not speak English.
Yes, that would be difficult to talk about this.
But you've helped people with carpal tunnel?
Yes. Well, here's the thing. This is why we have such great success with carpal tunnel, is because, again, I don't diagnose or anything like that, right? But patients come to us and they've come to me and say, well, I've had carpal tunnel and I'm still in pain. And they'll say that they have numbness in their thumb or so forth. And so carpal tunnel isn't always really, really carpal tunnel, because it can be, but it has all sorts of other causes. It could be from the neck. So when you have loss of a feeling and numbness, it could be coming from a pinched nerve in the neck, or it could be coming somewhere down. There are a lot of reasons, right? So what we do is we look at the whole. And so we treat from the neck. It could be coming, again, from the vertebrae, pinched nerve. We follow that nerve all the way down. We actually treat, the carpal tunnel area, the wrist, and all the fingers. So we look at where could it be starting, where could it be ending, and we just treat everything. And that's why we just have fantastic success, because this is non-invasive. We just look at everything and just give laser to the entire area.
Well, I may just take a shot at it by telling my daughter-in-law about this. But the problem is, we have 10-year-old triplet grandchildren. She has 10-year-old. She's a lawyer, in my son's firm. Doesn't have the time to drive them up here. Now, don't you have another place in Aventura?
We do. We're actually trying to find a physician there. We want to go into a physician's clinic.
Yeah.
But, again, with this device, there's this home device that she could purchase, and we give training as well. So she could come into the clinic, and maybe we could find a translator for her to in Italian and English. So anybody who speaks Italian and English, give us a call. But we could, show her how the laser works and show her how to use it and apply it. And it's very, very easy.
And you have seen people who you've treated who have really found relief.
Absolutely. One of the patients had a trigger finger that was locked, completely, totally locked. And after 2 weeks of treatment, able to use the finger, open up cans again. I mean, the problem is, so these patients come in, they can barely open the door handle, right? They can barely open anything, a can or something. And literally we will treat them, and then they will go to the door and open the door and say, I can't believe it. I wanted to see if I can open the door. Now I can open the door.
You're very convincing. I want everyone to know, because everybody's saying, okay, how do I call? All right, let me give you some information. Remember, this is Pencil Talk Radio. Let's give you first the phone number, and it's a free consultation. You can go and see Leslie and her staff, and she'll talk to you, and she'll show you what they do. And their phone number, get your pencils out, it's 561-405-9577. That's 561-405-9577. And you can get on their website. They have a beautiful website, lots of information. It's called Carmen carelaser.com. Carmen, C-A-R-M-E-N, carelaser.com. And I have to also tell you their main office is in Boca Raton, but they have an office in Plantation, Aventura. But you really should see Leslie. There are other people using all sorts of lasers, and lasers are coming into their own. But this is a very special laser, as Carmen was explaining to you. I would go to someone like Carmen, find out what's going on with your particular pain, and we call it advanced laser therapy. Advanced laser therapy. Something else that you should know is you can go on the web, go to YouTube, because you did do something before. You can see you and hear you on your YouTube interview we did with you, and then this one will be on YouTube also in the future. But what's really impressed me is that this was so personal for you, and I don't know if someone wasn't listening before, but this was so personal, and you didn't come by this casually.
That is correct. Yes, our daughter at 17 years old was hit with a disease called trigeminal neuralgia. So for that, patients out there don't know what that is. That's like stabbing shock pains in your lower jaw. Could be upper jaw, nose, eye, but it's in the face, and it is so painful that it's also labeled as a suicide disease. So when your 17-year-old daughter is struck with something like that, your life just stops, right? And so instead of putting her on these heavy-duty medications, she was on them, but I just said, she just can't stay on these. They're making her like a zombie, and she was a top athlete, couldn't play ice hockey anymore due to the medication. I said, we've got to find something that can help her, and that's how I came across laser therapy. And she's fine.
How did you come across it?
I started surfing online, and I found one place that was offering laser therapy, and I said, that's not possible. There's got to be more places here. And the more I surfed, the more I just saw that this was being used in Europe, in Russia, Japan. So they're very advanced. I mean, Russia is extremely advanced, and they're using laser for years, decades. And I wasn't understanding why it's not in our country. So that when she did get better, I said, you know what, I have to be involved with this, because I did grow up in Switzerland, have a medical background from there. So I said, this is what I have to be involved with. And Lee came on board, and now that she's, better and she's part of this team, she's actually helping people understand pain, because she knows what pain means, so she can really empathize with the patients. But the most exciting part is that not only do we have our clinic, but thanks to this laser that we're also treating our patients with, this coma therapy, we want to actually empower everybody, patients themselves, to heal themselves with this laser, that you don't have to suffer with pain. And also we're putting together a whole new program for professionals, where we're saying, add this laser into your practice, because the patients that come to me, they came from somewhere. They came from some physician that could not help them anymore. So here, you have the opportunity as a physician, health practitioner, to incorporate this laser. Now you have somebody with post-herpetic neuralgia, the shingles, after the shingles, and medical field, you really can't do much but give medication. So now I ask these physicians, come to us, talk to us. We will help you with these lasers. We're educating. We're going to give seminars. So that's the clinic is one part that really happened from this, but the bigger picture that I see is really educating everybody out there that can use this and really help your patients to the next level when surgery is not a possibility anymore. Many patients can't take medication. So what is your option? Well, now you have an option with this laser, and you can help your patients really become pain-free. And that's my next step. I want to empower everybody to use this laser. Come to us. We will educate you, help you. Funny enough, there are some physicians that have a laser, but it's in the closet. And I say, well, why is it there? Well, because I don't really know how to use it. And then I say, well, okay, then come to me. I will show you. I've done years now of this. I've spent hours at nighttime, weekends, treating friends, patients, family, that I did just to gain education on myself, just to understand, what does this do? So we even put together flu symptom protocol. I can't say the flu, right? But I can say the symptoms of the flu. An example, my daughter's father was just very, very sick with the flu for 3 days. And normally he's knocked out for weeks. And after the third day, Lee said, can I bring this to Dad? I said, absolutely. So she treated him. And within 2 hours of a 30-minute protocol that we do, I treat certain areas. So within 2 hours of that, he was able to get up, shower, eat, and started to feel better. And imagine this, if our physicians could give this to the elderly when they're sick and they come up with this flu symptom, treat this, we'd be so much better off. So yes, I do have a clinic, and yes, I'm very excited to help people, but I'm really looking at the bigger picture here. We really need to empower people and other physicians and health practitioners to start educating themselves that there is an addition to everything else they're doing. I'm not saying this is a replacement. It's an addition to what you're already doing. I'm
thinking in terms of, well, we all have a toothbrush, and now I have a water pick, and
right.
Maybe now we have to have the laser in our bathroom. So, I woke up, I have a pain. Wait a second.
Exactly. Well, my mom uses it. So the minute she woke up the other day, and the great thing is she's actually using it. So that's fantastic. I compliment her because she's 85 and I'm always around her. So now she's thinking laser. So, she woke up and she had a pain in her wrist, and she put the laser on, then it was gone. And so now you can get this before it develops into something chronic,
Well, you see, you're so far ahead of the game here, because so many people I know, they're sitting there saying, I have a pain. What
Absolutely.
do I do? Somewhere we started the show with some pain is very serious, as you've told us.
Right.
Trigeminal neuralgia.
I
got that word?
Yeah. Yes, you did.
Trigeminal neuralgia. But there are other people who have minor pains, as you just described. But the pain that's going to cause someone to have an operation like this carpal tunnel, that's pretty serious, because I've heard that a lot of times these operations don't even work very well.
You see, unfortunately, that's the thing. What they do is they cut this band that is very tight. But the problem is, the problem with that is you cut a band to give to kind of give more, to decompress that nerve that's being hurt. But what is your body going to do? Your body's going to heal that again, because that's what our body does. So that's really not going to take care of the problem. That's what I have experienced with my patients. I can't tell you how many have come and said, I've had both hands, carpal tunnel, I'm still in pain. Well, again, when we start treating the entire area, the neck, the nerve, the fingers, the hands, everything, they're fine.
So you're saying that you don't have to be the one doing this all the time. Maybe you start off initially with a couple of treatments, but then you sell the laser, which is a small, I've seen it. It's a
small device.
It's like
Delta
the size
laser.
of almost a remote.
Correct. And people say, well, this is so light, it doesn't feel like anything. Well, the fantastic thing, the way this has been developed, is the battery itself is separate. So the battery is the heavy part, and it's, you can put in your pocket or on the table, on the bed, then it has a nice cord. It's not in the wall. You can plug it in the wall, but it's made so fantastically that you can take it with you anywhere. And this battery lasts 12 to 24 hours. Depends on how much you use it and so forth. But so the hand device itself is very light. So it doesn't your hand doesn't get tired, because you're maybe, older, you're hurt or so forth, and you want to put this behind your neck or behind your back. So you're using it, for 20 minutes, 30 minutes a day. So because it's so lightweight, it will never cause you pain in your arm or in your hand. And it's very easy to use.
Well, I have to get on the phone, I guess. I'm going to jump into the family situation here. I adore them, but I think I will do something about this.
Good.
Do you have something written up on the carpal tunnel particularly?
Yes, we do.
Can I see it on your web?
Yes,
maybe?
I'll be very happy to.
Oh, yeah, I'd like to be able to do that.
Mm-hmm.
This is Leslie Carmen, who is not only beautiful, but she's so smart and so kind. And I just think you should call now for your free consultation. I think that it'll change your life. It's going to be 2016. Stop suffering.
Yes.
So the number is 561-405-9577. And, also, you should go to the one in Boca Raton if you can, because even though you have a place in Plantation, I know Aventura, but I think Boca is really where you're doing much of your work, isn't it?
Absolutely. And we can also always say, come for the consultation in Boca Raton and then be treated with laser by our laser specialists in Aventura and Plantation.
Well, this is a wonderful show, because I know there's so many people who are in pain. I mean, pain is a strange thing, a little bit of pain, but I just heard now about the flu. So, I mean, we just have to figure out that lasers are probably, that's the new technology of the 2016. A lot of people have had laser, and we know that. But this is extraordinary laser. It's very different. It's Comra.
It's Comra the laser. Yeah, Comra,
right.
Comra therapy, Delta laser. Yep. And the thing is just laser. Many people confuse that with the high powered, and not just high powered, but the burning, cutting.
Yeah, no, this is cold laser.
So this is cold laser, right?
Anything.
Exactly.
And, get on the web to carmencarelaser.com. And it's wonderful having you here. So if you have any nerve and joint pain, any arthritis, or accelerated, you want to recover from some operation you've just had, but over 200 other painful conditions, please do call Carmen Care. And I'm so glad you came in this morning.
Thank you so much, Anita, for having me. Have a wonderful day.
Yeah, same to you.
Thank you.